This recorded lecture will be going over Chapter 15, the Hematologic System. The functions of blood. Transportation of water, oxygen, nutrients, hormones, enzymes, and medications to cells. Transportation of carbon dioxide and other waste products away from the cells. Regulation of pH and acid-base balance with its buffering ability. Providing clotting factors for hemostasis. Blood is composed of formed elements and plasma. The formed elements are erythrocytes, neutrophils, lymphocytes, monocytes, eosinophils, basophils, and platelets. The plasma proteins are albumin, globulins, and fibrinogen. Albumin raises osmotic pressure at the capillary membrane, preventing fluid from leaking into tissue spaces. Fibrinogen is essential to the formation of blood clots. This image can be seen on page 334. And this map can be seen on page 335. Blood cells develop from stem cells located in the bone marrow through erythropoiesis. The kidney makes most of the body's erythropoietin, which then prompts erythrocyte production by the bone marrow. Erythropoiesis will require iron, vitamins B12, C, and E, folic acid, and amino acids. Most of these are obtained from proteins. Functions of the red blood cells. Red blood cells contain hemoglobin, which carries the oxygen to the cells and a portion of carbon dioxide away from cells. The normal laboratory range for red blood cells for adults is 4.2 to 6.2 million per millimeters, and it varies by gender. The normal laboratory range for hemoglobin in adults is 12 to 18 grams per deciliter, and this also varies by gender. Red blood cells will live for approximately 120 days. The spleen and the liver remove old, damaged red blood cells. White blood cells provide the first line of defense against microbial agents. The normal adult laboratory range for total leukocytes, or white blood cells, is 4,500 to 11,000 per millimeters cubed. They have a lifespan of about 13 to 20 days. Granulocytes are divided into neutrophils, eosinophils, and basophils, and they are all produced in the red bone marrow. Neutrophils make up to 54 to 62% of the white blood cell count. They work by engulfing and destroying bacteria through the process of phagocytosis. This means to consume or swallow up other cells or particles. An infection in the body will stimulate the production of neutrophils, resulting in a higher than normal white blood cell count, or leukocytosis. Eosinophils will increase in number during allergic reactions and in response to parasitic infections. Lymphocytes occur as B cells and T cells. B lymphocytes will change into plasma cells that produce immunoglobulins responsible for our humoral immune response. Some T cells are killer cells that fight antigens and provide cell-mediated immune response. Monocytes compose 3 to 7% of the white blood cells, and they become macrophages. They then migrate to the tissues, where they become phagocytes, fighting infection and ridding the body of foreign substances. Platelets provide the first line of protection after vasospasm to prevent bleeding by promoting clotting within the wall of a vessel that has been damaged. Fibrin strands derived from the plasma protein fibrinogen will attach to aggregated platelets to help form a clot. The normal laboratory platelet count range for an adult is 150,000 to 400,000 per millimeters cubed. The lifespan of a platelet is about 10 days. When the platelet count is low, there is a risk of spontaneous bleeding into the skin, kidney, brain, and other internal organs. The lymphatic system consists of lymph nodes, lymph channels, the spleen, and the thymus gland. The spleen, located in the upper left abdominal cavity below the diaphragm and behind the stomach, will filter the blood, removing pathogens, old blood cells, and debris. It also produces lymphocytes. It is a reservoir for extra blood. In response to hemorrhage, it will contract, and by contraction, the spleen releases some of its stored blood into the cardiovascular system. Lymph vessels will collect fluid and protein from the interstitial spaces and then return them to the bloodstream. Plasma volume decreases after 60 years, age 60. Older individuals will therefore have less blood volume. Bone marrow activity decreases by about 50% as years advance. The marrow will become infiltrated with fat and fibrotic tissue. Reduced bone marrow will inhibit full production of blood cells, so therefore the immune response is decreased, making the older adult more susceptible to infection. Anemia is not a normal sign of aging, and its presence should always prompt a thorough investigation as to the cause. In older adults, new cells will be produced at a slower rate, and the correction of anemia will become a longer process. Antibody response to vaccines is also decreased. When blood loss occurs, an older adult patient is at a greater risk for hypovolemia and shock. Blood is more prone to coagulate because platelets will tend to aggregate more with advancing age, and there are alterations in clotting activity. A daily low-dose aspirin can sometimes be prescribed to counteract this phenomenon. Pigment loss and yellowish cast to the skin are common changes associated with aging. These routine skin changes will make pallor and jaundice more difficult to discern in older adults. Hematology is the study of blood, blood components, and blood-forming tissues. Anemias, blood loss and hemorrhage, and hemolysis are all types of hematologic disorders that you could encounter during patient care. Chemicals and transfusions of the wrong blood type can cause hemolysis, or the destruction of red blood cells. On page 337, see the blue cultural considerations box. African Americans have the highest incidence of sickle cell disease. Megablastic anemia is more prevalent among those of Scandinavian descent and among African Americans. People of Middle Eastern origin may have a genetic predisposition to thalassemia. Whites have a higher incidence of leukemia, followed by Hispanics. On page 337, within box 15.1, you can also read about some factors that can alter the function of the hematologic system. Some blood disorders are iatrogenic. That means that they can be brought on by medical treatment. For example, blood dyscrasias, which is an imbalance in the number and types of cells, and other pathologic conditions of the blood could all be induced through at least 4 kinds of actions. This would include bone marrow suppression, interference with normal cell function, destruction of the blood cells by cytotoxic drugs, and destruction of cells by a transfusion reaction of mismatched blood. Some anti-neoplastic drugs will act to depress the bone marrow, which inevitably causes a reduced supply of blood cells. Diuretics like Lasix and hydrochlorothiazide can sometimes cause leukopenia, aplastic anemia, and abnormally low counts of platelets and granulocytes. Procanamide hydrochloride and quinidine, which are used to correct dysrhythmias of the heart, can also cause thrombocytopenia, agranulocytosis, and aplastic anemia. Nutritional deficiencies, like low protein or lack of vitamin C, can interfere with erythropoiesis and the normal functioning of blood cells. Bone marrow damage from toxic substances can also interfere with the production of blood cells. Malignant conditions like leukemia will cause the growth of abnormal blood cells and interfere with the production of normal cells. When considerable blood is lost through hemorrhage, the patient becomes anemic. You can prevent hemorrhage after surgery or childbirth by vigilantly assessing the amount of blood loss and by instituting measures to stop that loss if it becomes excessive. Nurses can help prevent anemia by promoting proper nutrition and educating the public about the possibility of nutritional anemia. Carefully monitor blood transfusions and promptly report any untoward reaction that could decrease the incidence of hemolysis from that reaction. Most testing for hematologic disorders will be done on the blood itself, with a sample obtained from a simple venipuncture. A few words of assurance and explanation can do much to relieve anxiety about needle sticks and promote cooperation. On page 338 in the green health promotion box, you can read about preventing blood disorders. Leukocyte counts will provide information about infection and possible immune disorders. Data about the number of platelets is valuable in diagnosing a variety of disease that affect or are affected by the clotting of blood. There are at least 12 different types of hemoglobin in human blood. The types can be designated by letters. For example, hemoglobin A is normal adult hemoglobin, hemoglobin F is normal fetal hemoglobin, and hemoglobin S is found in sickle cell disease. A hematocrit test will measure the volume of blood cells in relation to the volume of plasma. On page 339 within Table 15.1, you can read about some diagnostic tests for disorders of the hematologic system. Abnormal symptoms could result due to too little circulating blood or too little hemoglobin, too few platelets, a deficiency of normal neutrophils or lymphocytes, or too many abnormal blood cells. When there is an insufficient hemoglobin amount to carry oxygen to the cells, signs of oxygen deficit will occur. Be sure to inquire about renal disease, which could be a cause of anemia. Although pallor could be a sign of anemia, it's not the most reliable sign. Pale mucous membranes or pale conjunctiva of the eyes are better indicators of anemia. A very ruddy complexion with a red, florid appearance is typical for an excessive number of red blood cells. This is termed polycythemia. Jaundice, a yellowing discoloration of the skin and sclera of the eyes, can occur as a result of excessive destruction of red blood cells. When red blood cells are ruptured, bilirubin is released. The pigment will eventually find its way into the bloodstream, where it then causes jaundice. If hemolysis is occurring, the urine will often contain bilirubin, giving the urine a brown tea color. Bruises, purplish patches, and small red pinpoint lesions, known as petechiae, are typical of thrombocytopenic purpura, which is a hemorrhagic disease occasionally associated with a decrease in the number of circulating platelets. Bleeding under the skin and formation of bruises in response to the slightest trauma are common in anemias, leukemias, and diseases affecting the bone marrow and spleen. These could appear as darker areas on darker-skinned people. The gums or the roof of the mouth would be the best places to check for a bluish color or cyanosis in a dark-skinned person. Nutritional deficiencies contributing to anemia and the resultant hypoxia can lead to sore and painful gums and tongue. The tongue could be smooth and beefy red. Bleeding of the gums could occur with toothbrushing when the platelet count is low. Black tarry stools or coffee ground emesis will indicate a GI bleed. Hiatal hernia could also cause iron deficiency anemia. Bleeding into the joints or hemarthrosis is not uncommon in certain types of anemia or hemophilia. This can be evidenced by swelling and slight redness in the area of the joints, or the patient may move more slowly and with obvious discomfort. Enlarged lymph nodes can occur in a number of blood disorders, as well as infections and in immune disorders. Lymph node enlargement can be found while bathing a patient or helping with activities of daily living. Enlargement of the spleen, which also accompanies polycythemia as well as several other blood disorders, could be described by the patient as a feeling of fullness on the left side of the upper abdomen. Do not palpate deeply if there is tenderness in that area of the spleen, because this could cause a rupture of the spleen. Dizziness and altered mental function are often found in patients with blood disorders. Irritability, dizziness, difficulty concentrating, and headache can be caused by a decreased supply of oxygen to the brain. Physical activity will increase the demand for oxygen, but if there is not enough circulating red blood cells to carry that necessary oxygen, The patient will become physically weak and unable to engage in physical activity without severe fatigue and shortness of breath. On page 344 within Table 15.2, you can read about some problem statements as well as some nursing interventions for patients with blood disorders. You should plan nursing care to provide rest periods for the patient. Patients with a blood abnormality are at a higher risk of infection. Therefore, it's extremely important to use aseptic technique. Patients with a blood abnormality should not be exposed to anyone who is ill with a contagious disease, like colds or influenza. Nursing goals will include the following: preventing infection, conserving patient energy and preventing undue fatigue, correcting nutritional deficiencies, providing treatment to halt or slow disease process, control pain or discomfort, and identify and promptly report any complications. You should handle patients with blood dyscrasias gently to prevent any bruising and hematomas. Teach the patient about nutrition as well as medication administration, prevention of infection, and measures to prevent bleeding. Pain control will also be important for patients with sickle cell anemia, especially during crisis, patients with hemophilia with hemarthrosis, and patients with advanced leukemia. Monitor laboratory values for blood counts and determine whether the counts are improving to determine if the treatment and nursing actions are meeting patient needs. When an injury has occurred or spontaneous bleeding happens, you should immediately apply pressure to stop the bleeding. Severe bleeding can lead to irreversible hypovolemic shock and circulatory collapse due to a loss of intravascular fluid. Blood loss from an artery is bright red and will gush forth in spurts at regular intervals as the heart contracts. Blood from a severed or punctured vein will leak slowly and steadily and appears dark red. Patients with certain disorders like polycythemia vera and patients with high platelet counts are all at risk for hypercoagulability or an increased clotting state. Monitor circulation by checking peripheral pulses and skin color regularly. On page 346, in box 15.2, you can read about some techniques to control bleeding. On that same page, look at the purple box of clinical cues. Blood loss in the GI tract from an ulcer, tumor, or hiatal hernia can be seen in small amounts or in an amount large enough to make a stool appear black. This is called melena. Loss of 50 to 75 mL of blood from the upper GI tract is required before melena will appear. You can help decrease fatigue by spacing activities throughout the day and providing frequent rest periods. Fatigue is common with anemia, and it will affect all aspects of the patient's life. Serve small, frequent meals high in protein, vitamin C, and iron unless contraindicated. Provide mouth care before every meal. Assess the pain level at least every 4 hours and medicate as ordered. For joint pain, positioning and the use of cold or heat can be effective. Pain can escalate quickly for a patient in sickle cell crisis, so assess pain level at least every 2 hours. Less than optimal tissue perfusion and tissue hypoxia make it easier for pathogens to invade and cause infection. Patients with abnormalities of the blood need to be taught how to protect themselves from infection. Getting enough sleep and eating a well-balanced diet will help keep the immune system as healthy as possible under the circumstances. Bone marrow failure can occur due to abnormal cells overcrowding normal cells or due to inadequate production of the normal cells. Chemotherapy and radiation, thrombocytopenic purpura, and chemical toxicity could all be factors in bone marrow failure. Predisposition to anemia, thrombocytopenia, and decreased white blood cells will occur.